Hi, I'm Dr. Papanastasiou and I'm a plastic surgeon. I started my medical training at McGill University in 1972 and graduated in 1979. Following my graduation from medical school, I continued on specialty training in plastic surgery and obtained my medical certificate as a specialist in plastic surgery in 1986. It's important to note that, especially in Quebec, anybody who has a medical degree is able to perform certain cosmetic procedures. And this despite the fact that they may not have formal training in that particular procedure. What's important to note is that plastic surgeons do an extra 4 to 6 years of training following medical school. And it is during those 4 to 6 years that we learn the art and science of plastic and reconstructive surgery. So when a patient is researching his or her particular procedure, I think it's important to look not only into the procedure itself, but to research the surgeon as well. And there are 3 important things that one needs to look at. Firstly, what are the credentials of this surgeon? What formal training has he or she had? Secondly, what are the technical and artistic skills of this surgeon? And thirdly, what are the clinic characteristics, i.e., is there an on-site operating room? Is it staffed with certified nurses, certified anesthesiologists? These are all the important things that one needs to look at. The most popular operation that we do at our clinic is breast surgery, more specifically breast augmentation. This particular operation in 2008 in the United States actually surpassed liposuction as being the #1 procedure. I think it's always been an important part of a woman, the fact that well-proportioned breasts play a very important role in her life for a variety of reasons. #1, as an element of bonding with a newborn when she's breastfeeding the newborn. Secondly, breasts are important in her sexual life. And thirdly, just in terms of overall appearance. I think a well-proportioned breast gives the woman a heightened level of confidence and self-esteem. So the first implant I want to show you here is the silicone implant. Now this implant has been in existence for a long time. It was the favorite implant in the 80s and early 90s. It was actually taken off the market in 1992 because at the time they thought that it was related to certain autoimmune diseases such as scleroderma or arthritis, which has subsequently been proven not to be true. It's made of liquid silicone, and that's the reason it has not come back on the market. The reason being that if there's a little rupture, the liquid silicone will come out of the implant, and then you require a second operation to clean everything up and put in another implant. So these implants are no longer available. The second implant here is the saline or saltwater implant. These have actually been in existence for probably more than 30 years. They have one advantage, according to me, and that's the only advantage, and that is that we're able to place these implants into the breast through a small incision in the underarm. And that way we avoid any scars on the breast. In my mind, that's the only advantage to this implant. There are several disadvantages. The round fake look is one of them. Secondly, when you hold an implant in the position that it stays in the breast, you can see that it folds and causes ripples. Thirdly, feeling this implant, it feels like a bag of water, so it's not a natural feel. As well, we've had problems with capsular contracture, which basically is scar tissue that forms around the implant and makes the breast feel a little firmer. And finally, we have what's called the cohesive gel implant. Now, this implant is a silicone implant. This is the latest generation of silicone, which in Europe has existed since 1992, at the time when the previous silicone implants were taken off the market. And in Canada, it's been available since 2001, which is approximately when I started using them. They're excellent implants. The advantages to these implants are, first of all, they maintain their shape. Why? Because it's one solid piece of silicone. It's not a liquid. You can take a knife and cut it in two. You have two halves, so there's no leakage. So maintaining shape is important because they've shaped it in the shape of a breast. We call this the teardrop or anatomic shape. It won't ripple. You can deform it. It'll go back to its original shape again. And I think that's a big advantage. And also the feel of this implant has the texture of real breast tissue. So in 23 years of practice, after having used thousands of implants, I can honestly say there is no implant that comes close to this one here. It's quite puzzling to me as to why Quebec is a province where the majority of surgeons still use saline implants as opposed to gel. In all of Europe and all of the rest of Canada and many parts of the world, the majority of surgeons use gel and not saline. I don't have an answer as to why Quebec is different, but I think it's important for the patients to do their own research. And based on what I've already mentioned in this interview, I think it's important for patients to look at the facts, look at the advantages and disadvantages of each of those implants, and study that thoroughly, and then discuss it with the surgeon, because there are different options and they should know about them. So the first step in the process is the consultation. Now, during this process, the patient is first seen by my nurse, Michelle, who will see her, take a medical history, and then I'll see the patient, examine her, go over all the aspects of the surgery, all the various options, and then discuss possible risks and complications. Following this, she'll see Frankie, my assistant, who will go over with her other aspects of the surgery, maybe show her some pre- and post-operative photos, and give her some pamphlets that she can take home and read. So the next step in the process is what we call the review appointment. Now at this point, the patient comes back to us once a date of surgery has been fixed. She returns several weeks before for a session of questions and answers with us. We once again go over all the necessary things regarding the surgery, and then the patient sees Frankie once again, and she is given her pre- and post-operative instructions. She has her prescriptions for her medications, and as well a request for blood tests, which of course are necessary since she'll be undergoing general anesthesia. So on the day of surgery, the patient arrives, and quite normally she could have some anxieties. Our excellent nursing staff will take care of her, comfort her before the surgery. Our anesthesiologist will see her and he'll explain all that she needs to know about the anesthesia. And following the surgery, she'll spend some time in the recovery room until she's ready to go home. Now, as high as our preoperative and surgical standards are, we pride ourselves on our postoperative care. On the evening of surgery, each and every patient receives a phone call from myself. And during that phone call, I inquire how the patient's doing and try and allay any of the initial anxieties that she may have surrounding her surgery or her anesthesia. The next day she gets a similar phone call from Michelle in order to make sure that everything's on track. We usually see our patients within 1 or 2 days following surgery, and then we follow them very closely for the first year.